In this video, we're going to review the kinds of patients that you should test using Bristle, specifically patients with gingivitis or periodontal disease symptoms. Understanding the pathogenic bacteria in a patient's mouth can provide insight into the root cause symptoms or their risk for progression. This information can empower you to make more informed treatment decisions and implement preventive care. Let's get started. As a refresher, Bristle Saliva Test analyzes the oral microbiome, the makeup of bacteria, fungi, and viruses found in the oral cavity. Some of these microbes are harmful or pathogenic, causing damage to our mouths that drive conditions like caries or periodontal disease. Others are beneficial and help promote oral health while defending us against pathogenic microbes. Bristle identifies and measures the abundance of these microbes from a single saliva sample to provide root cause insights into your patient's oral health and risk for disease. By leveraging these insights, you can optimize dental care for your patient. Specific bacteria play a role in the development and progression of periodontal disease. These bacterial species, including ones like P. gingivalis, F. nucleatum, and T. forsythia, grow at the gum line while creating plaque, producing toxins, and initiating an inflammatory response. Some of these bacteria can even modify the oral cavity to create a more favorable environment for other harmful species to thrive. Bristle testing helps identify and measure these periodontal pathogens from a single saliva sample. Below you can see the range of scores that are based on the abundance and presence of the specific species that help drive gum disease or periodontal disease in patients. As we move from left to right, the abundance of these species increases, and this is translated into a simple 0 to 10 score that can provide insight into the underlying cause and risk for your patients. Importantly, the same pathogenic bacteria that drive periodontal disease can influence overall health, playing roles in conditions like cardiovascular disease, Alzheimer's, and diabetes. Managing oral health and the oral microbiome of your patients is a critical step to help them improve their overall health and manage their risk for systemic disease. The periodontal insights that oral microbiome testing can provide are valuable across a few different kinds of patients. Let's go through each. Oral microbiome testing can uncover the root cause drivers for patients previously or newly diagnosed with periodontal disease and provide insight into the severity of their infection. This information can help you determine treatment protocols, including specific in-office interventions, at-home care, and recall intervals. When the results are ready, you'll see the identities and abundance of bacteria contributing to their condition, as shown in the example on the left. This patient has a score of 8 out of 10, signifying that they have an extremely high abundance of periodontal pathogens. You can see each species of bacteria shown below, and their relative scores are also included. These scores help contribute and reflect the overall score that we provide. The majority of patients will present with at-risk or high-risk scores, usually above a score of 6.5. However, it's possible your patient presents with low scores despite having symptoms, which can indicate other issues. In this example, we're taking a patient who has both a high abundance of periodontal pathogens and has been diagnosed with periodontal disease in the clinic, and as you can see, we're able to provide data on the oral microbiome and the root cause of their condition, and use that data to design a custom treatment protocol to address the underlying cause of disease and help them improve their oral health. Screening patients with moderate symptoms can provide insight into the likelihood your patient has of progressing to worse stages of disease. A high abundance of pathogenic bacteria, or in our case a high gum inflammation score, indicates that they are at high risk of progression, while a low score would indicate that they're relatively stable. Screening patients with moderate symptoms can provide insight into the likelihood your patient has of progressing to worse stages of disease. A high abundance of pathogenic bacteria, or in our case, a high gum inflammation score, indicates they are at high risk of progression, while a low score indicates they are relatively stable. In this example, the patient has a slightly elevated abundance of periodontal pathogens detected in their oral microbiome, and they've been diagnosed in the clinic as having the early symptoms of gingivitis. We combine the results of their oral microbiome test with clinically identified symptoms to design a custom protocol to identify the underlying cause and mitigate their risk of progressing to irreversible stages of periodontal disease. Even though your patient may appear symptomatically healthy, it's possible they have an underlying abundance of pathogenic bacteria, increasing their risk of progressing to gingivitis and worse forms of disease. Screening these patients will help you understand their risk of periodontal disease and inform what steps you can take to prevent the progression. In this example, the patient has presented with a high abundance of periodontal pathogens. We've eliminated the specific bacteria that we detected for this example, but we take that data combined with a clinically diagnosed as healthy patient to craft a prevention-first treatment plan focused on addressing the pathogenic bacteria growing at their gum line to mitigate their risk of progressing to gingivitis or worse forms of disease. For patients who are undergoing treatments or have had interventions recently, we want to understand the efficacy of those interventions in reducing the abundance of the pathogenic bacteria that we detected in the first test. In this case, we're taking that same patient who has a high abundance of periodontal pathogens and was diagnosed with periodontal disease. We're going to assume that interventions and the protocol outlined was used for this patient, and by retesting, we can measure the efficacy of those interventions in reducing the abundance of periodontal pathogens and know that we've helped the patient mitigate their risk for the recurrence or growing severity of their disease. Collecting a saliva sample is easy and painless. If you have questions about how to collect saliva samples, you can watch our video by clicking the link shown below. In all cases, please make sure your patient avoids eating, drinking, or smoking for at least 30 minutes before providing their sample. Keep in mind that you will never collect a saliva sample during or directly after the patient's appointment. This is because the treatments you do during the appointment, like a prophy, will alter the patient's oral microbiome and skew their test results. The first option for sample collection is before the appointment and in office. In this case, the patient would arrive for their appointment and they would immediately be given a saliva collection tube by potentially the front office staff or a hygienist who's on duty. This is a particularly useful option for healthier new patients where you want to employ oral microbiome testing as a method of screening to get a baseline of oral health status. And it's also useful for existing patients who may have been diagnosed with periodontal disease previously or have a chronic condition where you already know that you want to employ root cause testing to help guide treatment decisions. The second option is to provide the test after the appointment for the patient to take home. This is a useful option if you have a patient and throughout the course of the appointment, you notice newly presenting symptoms of periodontal disease, or they were a new patient and you didn't know that they were previously diagnosed. Additionally, for patients who are undergoing treatments, the ability to send them home with a test can help ease their sample collection process and allow them to do it a few weeks after the treatment is employed. Finally, we're going to cover a few resources that we provide about how you can communicate oral microbiome testing to your patients. There are two primary resources. On the left, we have a Get Started guide. The link is shown below, and we've created a patient messaging guide, a series of scripts for introducing and communicating the value of oral microbiome testing to various types of patients, including those with periodontal disease or symptoms. Oral microbiome testing can identify underlying risk and uncover root cause insights into periodontal disease, empowering you to provide preventive and personalized care. Thanks for watching.